this is much of an issue. Done. Ooh, ho, ho, ho. A very young advocate, because he's still in his 20s, coming to us is because of poor posture, and that led to him having neck pain. কোথায় ব্যথাটা ছিল?
It was in my neck and lower back.
At this point of time, you are coming after how many months?
3 months.
And now, my favorite question. How many number of times did you do the exercises on a regular basis?
I defaulted, but out of 4 times prescribed, I did it maybe once.
Once or twice. So let's start treating his neck and his low back. Also has a little bit of knee issues, but we have given exercises and we will customize and change the plan a little bit because he's extremely young, right? And this is all the more so on the right side, and my bet is his right side is much more dominant and hyperactive compared to the left side. So let's start the treatment without further ado. So let's quick check the x-ray of his neck. This is AP view, this is lateral view. As you notice, his x-ray is perfect. The only thing that I can, like significant change that I can find is the reduced curvature or the lordosis of the cervical spine. So we have to bring back the lordosis by improving longus colli activation and neck extensor, the higher neck extensor activation. So these two things need to be strengthened so that the head is tilted forward or neutral, and then the neck muscles are able to hold the jaw from the bottom of it. So let's quick do the chiropractic treatment. Quick come over here and you can see a little bit of Dowger's hump or gibbus. It has reduced considerably from what it was, but he's still not doing the exercises properly as we always recommend. So if you do not follow the exercise and the other protocols that we tell you, it may not be 100% that your pain or your other sign and symptoms is reduced. So be aware of that. Okay? Pretty good. This is much of an issue, whatever it remains. Dhila chhede din. Not much actually. I'm feeling a little bit of crackiness. Elbow take pichone thele. Lovely. One more time. There you go. I love relocating the humeral head on the glenoid because more so we work like this, and the humeral head pushes anteriorly and stretches the anterior part of the labrum and all the anterior soft tissues. So I like to relocate it back to its own proper place. Come. Elbow pichone thele. Lovely. Chhede din. This is one of my favorite Sphinx pose to do a generalized lower cervical pop. Done. Lovely. Shuye. This is specifically CT junction. Oh, that was a good pop. Done. We'll do see the amount of kyphosis he has. So not always neck pain comes from the neck. It may also stem from thoracic spine or dorsal spine. So we need to clear this part out also. Scapulothoracic. Oh, gee. I like to do the costal cartilages too, because the ribs are sometimes like crunched up. We'll do on the other side. We'll do a little bit of C0, C1 from here, and a middle C4, C5-ish on the right there. Whoa, that was good. Relax, decompression, generalize, done. And the subox at the end. Whoop, like over here. And 3, 2, 1, done. There you go. Lamba shaash niye chhede. Oh, abar. Ooh, last. That's done. Next, we are doing some osteopathic technique, which is more of a relaxation process of the diaphragm. Because anywhere when there is spinal issues, spinal origin, I love to clean the diaphragm up based on his breathing rhythm. And done. You guys know my favorites. Ta ta ta. Up down মাথাটা করবেন. Very, very effective technique. And one. Alright, so we are done. Now we'll ask him to do a retest. ডান দিক বাঁ দিক মাথা ঘোরাবেন. আরেকবার. Up down. Sweet. If he's able to maintain with one set of exercise per day, I think we will give him some modified exercise for the thoracic spine. If he does that in the evening, so basically once each for cervical and thoracic, so 2 times a day, and that will clear up the hump that you guys saw, the Dowger's hump. মাথাটা যেরকম কুজো হয়ে যাচ্ছে. So that we have to treat so that there is no other problems going on in the near future. All right, thank you so much.
Stay fit, stay healthy.